Oh, did you hear about Sharon and Dave?
What? They have another kid?
What? No. About their cannabis prescription.
Wait, that's legal?
Yeah, it's been legal since 2018. They've been saying that it's super helped their quality of life.
So, can I get one with my condition? Am I eligible?
Well, that's what I was thinking, but there's this video on YouTube that goes over everything, so maybe we should watch it.
Yeah, let's go.
Hello, YouTube world. My name's Katie, and if you're new here, then welcome. And if you're not new, welcome back, love. So I'm really excited about this video. It's taken me a while to get this one together. So I hope you like this. This is an in-depth video, basically to a question that I feel was quite an asked question in the community, which is, am I even eligible for a cannabis prescription? So, if you're suffering from a medical condition and you may have heard about cannabis and the potential benefits that it has, maybe from a friend, a family member, or even a co worker, and you're wondering whether you yourself are eligible, then you have found the right video. Continue watching because by the end of this video, you are going to be armed with enough knowledge to go out there yourself and go and apply for a legal cannabis prescription. In the UK, accessing medical cannabis can be quite daunting. So I'm here to try and simplify this for you. I'm going to try and make this video as simple as possible so that it's really easy for you guys to share this to anybody who you may feel might benefit from this, family, friends, co-workers, like I say, people that might be on the older generation of life who don't quite understand what this is all about. Hopefully this video will help them and hopefully it helps you too. So yeah. Firstly, we're going to talk about eligibility. Then we're going to talk about the process. And lastly, we will go over how you yourself will be able to apply for a medical cannabis prescription and be pain-free. To be eligible for medical cannabis, you must have a qualifying condition that is not responding to conventional treatment. There must also be 2 forms of medication that has been proven to be ineffective. Patients also, this is very important, patients also need to not have a history of psychosis or schizophrenia. So when they say that you have to have had 2 conventional treatments that haven't worked in the past. So let me expand on this a little bit for you. Let's say, for example, that you have ADHD or you have tried, I believe one of them is Ritalin that they used to give. I don't know if they do it anymore, so excuse me if it's not. But I believe that it used to be Ritalin that they would give to ADHD patients. That would be one form of conventional treatment that you have tried. And if it has been proven to be ineffective, then obviously you have a tick. Then there is a second form of conventional treatment that you must have to have had that has been proven to be ineffective also before you can apply. So for myself, this was depression tablets and therapy. Those were my 2 forms that did not work, and I ended up just self-medicating myself. So when looking for a clinic, you actually have quite a few different options. Depending on your condition will depend on which clinic offers the service to you. And there are also some clinics that come together and have both under one roof. So let's get into the crux of it, shall we? What conditions are currently available on the list of eligibility for you to apply for your cannabis prescription? Alzheimer's, ADHD, agoraphobia, anxiety, arthritis, autistic spectrum disorder, back and neck problems, cancer-related pain, chronic fatigue syndrome, Crohn's, ulcerative colitis, eating disorders. I'm not sure how to say this, so I'm sorry if I butcher it, but this is why we're putting the actual names of them here. Ehlers-Danlos syndrome. Again, so sorry if I've butchered that. Endometriosis, epilepsy, fibromyalgia, insomnia/sleep conditions, IBS, major depressive disorder, depression, migraine, motor neuron disease, MS, multiple sclerosis, muscular skeletal pain/joint pain, neuropathic pain, nerve conditions, obsessive compulsive disorder, OCD, palliative care anxiety, Parkinson's symptoms, post-surgery pain, PTSD, restless leg syndrome, social anxiety disorder, stroke, substance use disorder, spasticity, stress, vomiting and nausea caused by chemotherapy. These are the ones that I could find currently on the Drug Science website and the CanCard website. It's quite a list. By no means am I claiming that this is the full list? But this is everything that I have been able to grab. After applying to your chosen clinic, you will receive an email with a date of a video consultation that you will then pay for before you have the consultation. Once you're at the consultation stage, it's just like, once they send you an email, there'll be like a little link in it, and you'll click the link and it'll go straight onto like a Google page. You just accept your webcam, you accept the microphone. It will then slam you onto the page with the doctor or the specialist, and it's at this point that you could go over any medication that you have in the past. You can tell them if you are self-medicating with flour or oil yourself, how much you are using, how much you think you may need. It's at this point that you can tell the doctor slash specialist that you would like a lower amount, maybe a sativa is enough for you during the daytime and the nighttime. Don't worry, I will go over these in a later video, so don't worry about that too much. But the doctor will have enough knowledge based on your history and things that you tell him to be able to make an informative decision of what they think is best for you. So once you've gone over everything with the doctor, you may already have like a brief outline of a prescription that you would like to try if you are accepted into the program. So they will pencil this in basically to make the process faster. If you are accepted, then they'll just send you an email link. The pharmacy will send you an email link for you to pay for the prescription that you went over with on the video call, and it just makes things really, really fast if they've already written down this information and they don't have to have another call with you first if you are accepted. So why can't your GP just prescribe you cannabis? So you need a specialist in order to prescribe you medical cannabis. The reason is your GP is simply not a specialist. In order to prescribe CBPMs, cannabis-based product medicine, there has to have been a process of training, and this is where you get your specialist from. The specialist has gone through training with cannabis, understands, more so than the GP. And this is a costly thing that they have to pay for themselves in order to go for on this course. So there's not a lot of GPs in this country, let alone specialists. So you're not going to have a specialist at a GP readily available to just prescribe you it. The amount of specialists in the UK is a lot lower than the GPs anyway, so trying to find a specialist that's got the time and availability to come over and basically shadow that GP in order to be able to prescribe that patient cannabis, it's nonsensical. It could never happen with the amount of patients that need this medicine. So what happened was, in 2018, when it was legalized for medicinal purposes only, it was also stated then that obviously it could be dispensed by specialists who are involved in this environment. So private clinics started to open up with their own specialists. They brought in specialists in-house and they started to charge privately for a prescription. The prescription charge was huge in 2018. The price now has come dramatically down. One of the reasons because of Patient 2021 drug science, which we'll get onto later. So now you have a lot of these clinics to be able to prescribe you the medical cannabis. Right, so the next thing you will need to do is go to your GP. Yes, your GP that cannot prescribe you any medical cannabis, and you simply ask for a summary of care records. Summary of care records. You can get this just by asking the receptionist, and it's basically just to provide information to your chosen clinic about your diagnosis, about any previous medication, again, that you've tried and it's failed in the past, and just basic knowledge about you so that they are able to perform the beneficial task of getting you some cannabis. Once you have sent all over your information, the summary of care records, and anything else that they may need, this will all get sent to a board of directors. This sounds very scary, but all it is people basically making the decision on whether or not medical cannabis is going to be beneficial to you. So if they have a person in front of them that has back pain, they've been in a car accident in, 1980, and they've had a dislodged disc for however long, they've been taking diazepam, it hasn't worked, they've been taking opiates or whatever, and yeah, it chills them out, but it doesn't work, and they really would benefit from medical cannabis. They would have this in front of them and say, oh, yep, tick, 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 wherever it gets ticked, absolutely fine, push it through. At that point, that's when you'll get that email where the payment link is in, and you'll be able to pay for that prescription that you went over previously with the video call. Now, the prescription will get sent from a pharmacy. The only clinic that I know that has an in-house pharmacy currently is Alternaleaf. So if your clinic does not have an in-house pharmacy, it will need to be sent to a pharmacy that is able to dispense the medical cannabis to you. There are many pharmacies, and this is all done online. Do not worry, you do not need to find anywhere. This all gets done online, and it all gets delivered straight to your door. Once the pharmacy has sent you the email link and you have paid for your prescription, sometimes it will tell you in the email that if it is paid before a certain time, so I think mine is before 4 p.m., then they will dispatch that day. Sometimes it could be between 2 p.m, 12:30. All different clinics differ because they use different delivery services. Once you have paid and the pharmacy have dispatched your medicine, you will get a tracking information email. I highly recommend, this is your number one tip, are you listening? I highly recommend that you download whatever app it is that is delivering your medicine. So if you know DPD is delivering your medicine, go and download the DPD app. If you know APC is delivering your medicine, go and download APC. If you know that Royal Mail is, what am I going to say? Download Royal Mail. This is a nice little hack for when you can direct like everything about it in your app. So if you're not going to be home, you're able to then say to them, can you please deliver on a certain date? Or I would personally try and get somebody to come around and sign for you if you're not in, because the difference between you getting your medicine one day on a Friday and then again on a Monday is I couldn't be able to know. If you need your medicine, then please make sure someone is at home in order for them to sign for it. But the great thing about the apps is you will always know when it's coming, because DPD will tell you. You get an hour window of when it's going to come. Also APC, which is overnight. They usually come really, really early in the morning. So tip on that one, usually between 10 and 12 p.m. So that's my tip. Download the app. Unfortunately, some pharmacies do charge for Saturday deliveries. I have not been unfortunate enough to run into that. However, I do know that there are some that will charge, I believe, up to like £9 for a Saturday delivery. So if you can get your money and get that prescription paid for before then, I highly recommend that too. So after that, that's pretty much it. You can sit back and wait for your delivery to come. So by understanding the eligibility process and following it step by step, you can unlock the benefits too of medical cannabis and hopefully start having a better quality of life. But before that, if this video has helped you in any way, or you think that someone might benefit from this video in any way, please consider smashing that like button down below so that it forces YouTube to shoot it out into the algorithm and hopefully help more people understand the process of doing this. Also consider subscribing if you want to carry on in this little series. I have a few videos lined up. Thank you, love. Alright, so the first step is to go to Drug Science Project 20. Hit enter and you can see here we've got drugscience.org. So we click that and it says access medical cannabis with T21. T21 is the name of the project, called Project 2021. It was just basically the project of them kicking off in 2021 of this science, basically collecting data from us as patients to show how beneficial medical cannabis has or hasn't been for you. And all of this data and information is actually being pushed back to the NHS to provide some sort of push to say, hey, look, this is actually helping. Look at how many people who are paying for a prescription on this, and we could really do with this in our medicine on the NHS. So that's what that is. So T21, what you will do over here is if you come up here to T21 on this little tab, you can hover over it and it says apply. So if you click apply, it will then go over what I basically said to you in this video. All right. So now it says, which clinic should I choose to treat my condition? As I said, these are the different clinics that will depend on the specialist type of clinic that you are after. So you click here and you go to your condition. So for the benefit of this video, I am going to say social anxiety disorder. Okay, now these are the clinics that have popped up. However, I do want to make you aware that you can go direct to clinics. This is only one way of doing so. So if you actually have heard good things about Alternaleaf, which is the clinic that I am with and that I have actually done videos on, then you can go to them directly. You can click on the name of the company, it will send you to them, and you can apply now by clicking apply online, or you can also telephone them and give them a call if you want to speak to somebody about it. They are really, really nice. Most clinics I've dealt with have been absolutely amazing. So if you want any more information, then please do go ahead and do that. But for the purpose, again, of this video, I'm just going to show you how you would do it like this. So you click on what your disorder is, and you are then meted with these different options. Now, I want to make you aware of the initial consultation, okay? That is the amount of money you will pay for a video consultation. So these I do not recommend at $250 and $399. I don't recommend that. Even Zerenia is $250, which again is a little egregious for my personal opinion. So we have the lowest available is Alternaleaf at $49. Okay, but if you choose not to go with them, of course, then you have these initial consultation charges. All right, so let's say that you're going to go with Cannabis Clinic here. You simply go and click into the company. You then scroll down and it will show you your initial consultation is £250, and a follow-up consultation, which is usually after 4 weeks, and then a 3-month, and then a six month, and then a 9-month. Right, so be aware of the follow-up consultations also. Remember, this isn't available in NHS, which is why we have to pay so much money. Yeah, I know, I can hear you saying, oh my god, how much money? Yes, I know, which is why we are doing this project, to try and show the NHS this is outrageous, how much money we have to pay for medicine. Okay, but continuing, this is what you would do, is apply. All right, and you can just again apply online, or you can contact them with the telephone number there. But again, let's just say that you're going to click and apply online. You get sent directly to the cannabis clinic that you have chosen for you to apply for. I don't know how to apply to this one because I haven't applied to it. So again, highly recommend that you check out the initial consultations. Alternaleaf is very competitive here with the initial consultation of £49. That's right, £49, not $250 for your video consultation. Your follow-up consultation, again after 4 weeks, 3 months, 6 months, 9 months, is only £49, half price to the other one. Repeat prescriptions are free. Some clinics do charge for repeat prescriptions. So obviously you will have your prescription each month. This will be charged per month for you to re-prescribe, your medication. Zerenia, they are now free. They used to be £15, but I guess everyone has had to, oh no, there's 2 clinics that are on £30. Nope, 3 clinics. Nope, there's a lot more, sorry. Excuse what I said, Jesus. So that's how you would apply. All links are going to be down below, so you can go ahead and do your own research, or you can just go ahead and apply if you already have a condition that is qualifying that I've gone over in this video. I hope this helps. I really, really hope this helps. If it does, please push the thumbs up button, subscribe if you want to, make sure that this video hits the people that it needs to hit, share it with your friends, family, co-workers, whoever you feel will benefit from this information. Well, until next time, guys, thank you so much for watching. The algorithm gods seem to think that you'll like this video, so why not give that a go while you're here? And I guess there's only one thing left for me to say, which is look after yourselves and look after each other. Bye.